Hi, I'm Nurse CC, and I'm going to do a IV insertion how-to video, just kind of give you some tips and pointers on the steps to take to make an IV for a patient, the reasons why the patients use IVs and doctors order them, and the supplies that you would use for IVs. IV access is used to give fluids and fluid replacement, draw labs, give medication like antibiotics or pain medication. You can also use IV access to induce IV sedation for procedures and surgical cases such as that. I work in the ambulatory surgery unit, and we establish IV access on all patients for the purpose of induction of anesthesia and to also manage pain before, during, and after the surgical procedure. There are several types of IV catheter that you can use. Most of the time when you're in an emergency room or a patient comes in by ambulance, they have one of these kinds of catheters in place. So this one is a 16 gauge. This is a really large bore IV. Most of the time they put these in larger sites on the body, like the antecubital area near the inside of the elbow. This one is a 14 gauge. It's even larger than the 16 gauge because the smaller the number, the bigger the needle. And these needles have no connection to them, so once you use this kind of a needle to access a vein, you must then immediately either lock it with a cap on the end and maintain the patency of it without having the patient bleed out, or you want to immediately attach some IV fluids and go ahead and run that line and or medicate the patient with the line before, during, or after the process. So where I work, we use these 20 gauge angiocaths, and they have a connection catheter to it that has a double port, and we can use this port when we are starting the line to draw labs. We can also use the multiple ports for different things, so the patient may have blood running in one and IV fluids running in the other, or they may have something running in one and the other one just there to access to add medication to the line as the fluids are running simultaneously. So this particular one is a 20 gauge, and this is what our unit preferably uses and standard requests for healthy patients or patients with veins that are, big enough and stable enough to handle this kind of a gauge. But we do have times where we have to use a 22 gauge on elderly patients or critically ill patients like dialysis patients or patients who've had previous rounds of chemotherapy and their veins are not as patent as other patients. We also have times where we will put a 20 in one location and a 22 in the other. We try to only do that for certain kinds of cases because, of course, multiple lines put them at multiple risk for infections. It also puts them at risk for bleeding and other, adverse events because of the open areas to the skin and the open access to the veins. We have, in extreme cases, had to use a 24 gauge, which is usually used on neonates or babies when they're born or when they present themselves in various hospital-related entities like emergency rooms or clinics for, access to the veins for the use of IV fluids and or IV medication. So one of the biggest things about IVs is selecting the right kind of catheter and also the right site on the patient to start the IV. Sometimes as a nurse or a doctor or a healthcare practitioner, you run into different situations. So for instance, if the patient is covered in tattoos, it may be harder to see the veins. If they are a darker or a lighter skin tone, then it's harder to see the veins through the skin. Some of the patients are more muscular or obese, and so It's harder to feel the veins on the patient because there's more adipose tissue. If you select a vein that's in the hand, sometimes you can see the veins, but as you can see with this one, they are very mobile, and so you're going to have to use your fingers to stabilize that vein. When you are trying to access it, it's close to another vein, so you got to pick the one that has the least amount of resistance and also the least amount of valves and such. As you can see on this gentleman's hand, he has a couple of veins that are easy to identify because he is more muscular and healthier, probably very hydrated as well. So even though the veins look good in theory, they are very mobile, and so you will need to hold them in a manner in which to secure them and start a line on him. And then, like, as you can see on my hand, you know, mine are not as pronounced as these, so once you apply the tourniquet and start to pump them up, they may pump up and look like this. These are very spongy, and you can find where they connect. You're going to palpate the vein for the sponginess, and you're going to locate a vein that would be optimal for the kind of medication that you're going to use. If it's just for fluid replacement, you can use these here in the hand. There are some in the wrist, but if you need something that is bigger for the bigger gauge needles, you're going to try and access something here in the anticube. And these are usually leaned towards more by emergency staff, like ambulance drivers and emergency room patients, but also cardiac patients that are getting cardiac surgeries have these larger gauge angiocaths in their body, and so you have to find a vein that'll be able to support this size gauge. So for the purpose of this video, I am going to start an IV on this gentleman, and you'll need a IV start kit. When you open this kit, you'll find the materials that are inside, and we'll go over shortly what they are used for. You'll need a flush. I'm just going to start a 20 gauge on this gentleman because he is 18 years old and healthy and has really good veins. So you're going to perform hand hygiene, of course. In my unit, we use the phone outside of the patient's room to foam in as we're going in. I'm going to don gloves. That is to protect yourself and also to protect the patient. Common mistakes when starting an IV is selecting a vein that is not long enough to support the catheter that you're going to leave in the patient once you remove the needle that is a part of this angiocath set. You need to clean the patient's skin with a CHG solution, or you can just use regular alcohol or saline to do so. You'll need a tegaderm to cover the IV site. You're going to apply a tourniquet, and if you apply it too tight, then you will collapse the veins and decrease the amount of blood that's flowing to the intended IV site, and you'll find that the veins are flatter and harder to access. You will need some tape to secure the line once you attach it, and there's always usually some additional gauze in there in case you need that if there is a little bit of spillage from the actual. So when you open up this particular IV catheter, which I've never seen before, I moved here to Virginia, but this particular catheter has an extension to it, and when you are starting the IV, you're going to insert this needle into the patient's vein. There is a butterfly looking apparatus here that is used for stabilizing the catheter once it is inside of the patient's vein. There is the needle here itself that you can remove once you access the needle. They come with the bevel already up, and the bevel is used to get your flash here in this chamber right in the pink area of this IV catheter. Once you do access this particular part of the vein, you're going to go ahead and clamp it, remove these tips, and then you will add this particular piece to it, and that will allow you to flush it. So we're going to go ahead and apply the tourniquet to the patient's arm. We've already inspected the arm to find where the veins are located that we're looking for. You're going to tie a slip knot that can easily be released when you're no longer needing that. And then you're going to clean the patient's arm and or hand or wrist. I'm going to start this one in the hand because this gentleman has really nice veins in his hand. Cleansing it with the CHG, having the patient to pump their fist while the tourniquet is in place allows the blood to flow down to the hand, but then it will backflow into the veins that we are looking at for this particular IV. Patting the veins in the intended areas or the areas that you've selected will help to puff the veins up to make them more spongy to your touch. Keep pumping for me, sir. All right. Looks like we may have a good one to choose from. Yes, they are pumping up really nicely. You can feel the sponginess of the veins. You can stop. All right, I'm going to go ahead and start this IV for time purposes. We don't want to run out of time for this instruction video. All right, so you're going to insert the needle at a 5 to 10 degree angle. Because this is a hand IV, there is little to no adipose tissue available, and you don't have a lot of room for missed steps. Brace yourself, sir. This is going to be a bee sting. All right, you're looking for a flash. And as you can see, there is the flash there. The blood is filling up here in that chamber. You'll hold on to the pink part and pull back on the white. And you should get a good fill up into this chamber here. You're going to clamp it, secure the tips, place a catheter there. You could place a vacutainer there to draw blood. Cover it with a tegaderm. At this point, you're going to attach a saline flush. Open up your line. You're going to flush it. And you're looking for signs of infiltration. Infiltration would mean where there is some bubbling at the site where the needle was inserted into the body, also above where the catheter is currently placed. If it flushes really well and the saline goes in smoothly and you don't see signs of infiltration, then it's safe to say that you have selected a good IV vein, and a site, and secured a really good IV. Use this tape to put across this pink butterfly shape. That will provide a foundation so that if the patient is texting or fiddling with the remote or otherwise trying to sign a form or a consent, then the IV is still stable. It's best to use tape to secure